Now I would like to invite our today's speakers, guests to come upon the dais. सर्वप्रथम आज की तालियों के बीच में मैं इन सभी गेस्ट को आमंत्रित करता हूं मंच पर। कृपया शीघ्र ही मंचस्थ हो। डॉक्टर सुनील पौडेल जी, फाउंडर डायरेक्टर स्पार्क ग्रुप ऑफ हॉस्पिटल, उनका भी हम जोरदार तालियों के बीच में स्वागत करते हैं मंच पर।
अरे साहब, हम मतलब आपको सच बोलते हैं, देखो इन चक्करों में मत पड़ना। इन चक्करों में पड़ता तो स्वामी रामदेव, बहुत से बाबा आजकल कहां है पता है ना? बहुत से बाबा जेलों में ही है, सबको पता है। और 5-5, 6 से 10 सालों से है। एक दिन तो एक बाबा ने मुझसे जेल से फोन कर दिया। मैंने कहा आप कौन? बोले मैं वो। मैंने तो तुरंत काटा। मैंने कहा भाई मामला लपेटेगा अपने को भी। चोरी से फोन कर रहा है, बाबा जी आप मुझे बचाओ। मैंने कहा भाई मामला गड़बड़। मैं यूके गया तो बोले बाबा जी आप बहुत अच्छे हो। और अच्छा वो मुंबई में पहले गार गाया तो फूंक मारे, तो मैंने सोचा कुछ जैसे वो उड़ीसा में उधर करते हैं ना हुलहुली, तो मैंने सोचा ये कोई परंपरा होगी। तो मैंने कि फूंक क्यों मार रहे? बोले बाबा जी फ्लाइंग किस दे रहे। अच्छा हम इतने बावड़े, हमको किसका ही नहीं पता, फ्लाइंग किसका कैसे बताओ। फिर यूके गए तो बोले बाबा जी आपको आई लव यू। ठीक है, सेम टू यू। आई कैन हग यू। मैंने कहा हग अपने घर जाके, सच्ची बोलना। आई कैन हग यू। मैंने कहा हमारी भाई ऐसे सड़क पे नहीं हगते। हाँ, इन चक्करों में मत पड़ना बच्चों। सारा ध्यान किस पर देना? अपने ज्ञान को बढ़ाने में, अपने चरित्र को बड़ा बनाने में, अपने व्यक्तित्व को बड़ा बनाने में। तुम स्वामी रामदेव की तरह बनो, सारी दुनिया तुम्हारे पीछे चलेगी। तो भाई अभी तक हम योग वाले थे, आयुर्वेद वाले थे, ये बात पक्की है, सारी दुनिया ही जानती है। अब योग आयुर्वेद के साथ साथ हम समान रूप से नेचुरोपैथी को राष्ट्रीय और वैश्विक स्तर पर गौरव दिलाएंगे। आप लोग लगे रहिए। बहुत बहुत धन्यवाद। आप सब लोग इतने समर्थ हैं, बड़े बड़े महापुरुष हैं, और आपसे हम मिलते रहेंगे। अभी तो ये शुरुआत हुई है, अभी तो मंजिलें बहुत आगे की हैं। बहुत बहुत प्रणाम।
डॉक्टर सुनील पौडेल, फाउंडर डायरेक्टर स्पार्क ग्रुप ऑफ हॉस्पिटल।
ये जो प्राइड है, प्राउड है, स्वाभिमान है, गौरव है, आत्म गौरव है, ये बढ़ेगा। और उसको बढ़ाने के लिए हमारे सारे आपके जो गुरुजन हैं, जिन्होंने बहुत गहन अनुसंधान किया है, वो आपके सामने जो प्रेजेंटेशन आदि दे रहे हैं उसको खूब ध्यान से सुनिए। जी प्रारंभ कीजिए भाई साहब, डॉक्टर साहब।
आप लोगों को प्रणाम, गुरुजी को प्रणाम। So my topic given to me was role of naturopathy in holistic pain management, and my focus has been spine. I've been treating spinal case since I graduated. Today I am going to talk about something that has never been spoken in this field. I don't see many people treating spine, so I am a rare one of them, and today we are going to talk about how fast a sequestrated disc can heal with a case study. So my approach was integrative naturopathic approach. So let's not waste time and go into. So आपने सुना होगा स्लिप डिस्क, ये कॉमन टर्म है, और आप लोगों ने सुना होगा साइटिका, सियाटिका भी बोलते हैं. So all are same, sciatica or sciatica or slip disc. The cause could be slip disc of any sciatic pain. You can see the pain can be in one leg or the either leg. The cause is lumbar herniated disc, LSD. Okay, it's a very common now because people don't do exercise. People are over dependent on the technology. They are sitting all the time, and if they do exercise, they will be doing wrong exercise. जिम में आप देखो वो भी रॉन्ग एक्सरसाइज कर रहा है, योगा आप देखो वो भी रॉन्ग कर रहा है. तो इसकी वजह से आजकल स्लिप डिस्क और साइटिका एकदम ज्यादा है. उसकी नंबर 1 कॉज है HLD, herniated lumbar disc. So almost 98+% of sciatica is caused by slip disc or the herniated disc. So usually pain will be in one leg, but it can go to either leg. There will be radiation and paresthesia. Both could be only pain, could be only paresthesia. Paresthesia is tingling, numbness. And it has become very frequent, as I told you, but the problem lies in development of clinical guidance. Okay? Not only patients are confused, doctors are also confused, even the surgeons are confused, whether to operate or not. I had got the privilege of talking to Dr. Cherian. He was the secretary of Asian Neurosurgical Society. वो क्या बोले पता है मुझे? हाँ, ऑपरेट तो मैं करूंगा, उसके बाद भगवान को ही प्रार्थना करना. So this is the bitter truth of operating on sciatic patients. There is no universal guidelines for any lumbar disc herniation. Okay, if you ask any surgeons, any top clinicians, he won't be able to give you precise answer. There is no precise answer whether you need to go for surgery or conservative management will do. According to me, no matter what, conservative management will do. Let's go into that. Okay, LDH, lumbar disc herniation, sometimes can lead to disc sequestration. As you can follow the pointer, this is the stage 1, what we call disc bulge. Okay, this is stage 2, protrusion. This is stage 3, extrusion, and this is stage 4, sequestration. Till few years back, people used to think protrusion, extrusion, and sequestration need surgery. Now it is changing. Okay, so let me go with slight anatomy. Okay, this is the fibrous layer, annulus. This is the nucleus. Okay, because of the pressure we put, because of our lifestyle, it starts slowly migrating. That's called protrusion. And once that annulus gets torn apart, that's called extrusion. And when it goes to another level, a piece of the nucleus falls off from the mother piece. That's called sequestration. वो टुकड़ा spinal canal के अंदर migrate करता है. It can migrate cranially, I mean upwards. That's called cranial migration. It can go downwards. That's called caudal migration. And the symptoms can vary. किसी को थोड़ा सा दर्द होता है, किसी को भयानक. Okay, it not only after sequestration, it can give lots of trouble. Sometimes paralysis of one limb. So today we are talking about a patient who started having paralysis after disc sequestration. So this is one sample I'm showing you. This is L4. This is T2 sagittal view of lumbosacral spine. You can see this is L4 and this is L5. And now we can see there is, you can see L3, 4 is also affected. There is posterior annular fissure. The annulus is giving way, and over here you can see there is protrusion, and this large disc fragment is sequestrated. Okay, this is the sequestrated part that has come off L4, 5 disc maybe, because sometimes it can migrate from upwards as well. And you can see this is the sequestrated disc. वो टुकड़ा आप ये spinal canal है, okay, central spinal canal ये है, so it is traveling below. So this is caudal migration, and it is impinging on the spinal nerve roots over here. Okay, so this is, so effectiveness of conservative approach in treating LDH is well supported by massive body of research. You can think, oh no, disc herniation might require surgery. No, you are wrong. If you go and study, if you do a lot of research, and you can find conservative management without surgery also, lots of disc herniation can be treated. So I'll go into reference later. You can note down the references. Disc herniation basically have a very good success record that ranges from 60 to 90% through conservative management. It's not I'm saying, the research is, the evidence is saying, okay, up to 90% till now. I believe up to 98, 99% of the disc herniation can heal naturally. That's my belief, but till now evidence says only up to 60 to 90% of the disc herniation heals quite naturally, easily with conservative management. But unfortunately, there has been no study till now. I could not find even one study where naturopathy has been tried for the management of disc sequestration. You cannot find even one research paper. This could be the first one. Okay, this is the gentleman who came to us with lot of pain. I personally don't publish patient picture or patient's any identity on research papers, but anyhow, this is conference, and he insisted on showing his picture so that people believe. Okay, so he had got large lumbar disc herniation with sequestration, and after the patient comes, we follow strict guidelines on evaluating him, whether the patient has got red flags, yellow flags. I've been teaching spine for around 5 years, so I might teach you this in fellowship. We are planning to develop 1-year fellowship in spine, spinal diagnosis and management. So this is a stringent physical examination protocol we follow, and these were the findings. He had no associated comorbidities and clinical presentation. He had got right sciatica and neuroclaudication. Neuroclaudication means the patient cannot walk. The sciatic pain starts while standing or walking. Okay, that's very typical of spinal stenosis. And it affected his daily living. His SLR on the right was 60 degree. And can you see this right? Okay. The moment patient enters into my clinic, I ask them to walk either on heels or on toes. Okay. This is a red flag. If the patient is not able to walk either on heels or on toes, that's a red flag. And till now, till let's say last 5 years, I had been sending such patients to surgery, but not now, because the protocol is changing. I'm gaining confidence and I'm teaching this as well. He had got right dorsiflexor weakness. The power was 2 plus by 5, and extensor hallucis longus power was 2 minus by 5. So he was not able to walk on heels. Okay, जब भी पेशेंट आए, sciatica पेशेंट आए, आप बोलो ऐसे, या ऐसे. If they cannot either walk on toes or heels, there is something massive wrong going on. His reflexes were also diminished. That means he was slowly going into paralysis. So this is his MRI. This is again T2 sagittal section, where we can see he had got large disc herniation at L3 and 4. And you can see this fragment is going down. That is called caudal migration. Okay, and you can see over here one large disc fragment inside the central canal. Okay, he had got multiple disc prolapses, L4, 5 also. You can see something going on. Okay, let's focus and see. You can see the disc fragment behind L4 body, the vertebral body of L4. So this is the fragment we were trying to treat. So all of the doctors and surgeons had one piece of advice. He went to several of them, and everyone told surgery. There is nothing that this can heal with conservative management, was their advice. But have you heard this term, FBSS? Anyone? He never wanted to go for surgery because his sister had a history of FBSS, failed back surgery syndrome. If I see 50 patients in a day, I usually see 50 to 60 patients in a day, and up to 5% of them come with FBSS, failed back surgery syndrome. Okay? Lots of surgeries fail. I'll show you later in discussion part that the success of surgery is only 50%. Whereas I just showed you the success rate of conservative management is 60 to 90% according to these researches. Right? So still people are scared. They go for surgery because they make a lot of money out of surgery. एक बार सर्जरी हो जाए फिर दूसरी बार सर्जरी की जरूरत पड़ेगी, तीसरी बार फिर पड़ेगी. Spinal surgeries, you might need recurrent surgeries, and the success rate keeps on falling down. I'll show you that in discussion part. So his sister had FBSS that saved his life. He never wanted to go for surgery, क्योंकि I mean he saw that how much she suffered after having surgery and after having failed back surgery syndrome. This is also called nowadays, because the term is so much violent, now they have changed the term into post-spinal surgery syndrome. Okay? So I love this term, failed back surgery syndrome. And we use integrative naturopathic approach. And this is the MRI after 3 months. Okay? T2 sagittal section again. So I'm showing you before and after MRI. The disc fragment over here is completely resolved. It has completely resolved. And the duration of treatment was 3 months. No admission was required. No surgery was required. Most of the treatments was done at home, not in clinic or hospital. Even the motor deficits were cured. I told you in the before, red flags, right? He had got paralysis of his muscles below knee. So even that got cured totally. So within 3 months, he was totally cured. Maybe it was cured before that, but we didn't have, the patient did not have enough money to repeat the MRI. MRI costs a lot, right? So what was the protocol? The protocol is counseling, reassurance, and cognitive behavioral therapy. So this is the thing that will treat the patient's pain. The moment you can tell a patient confidently, no, surgery is not required, half of his pain dies immediately. Okay? There is something called descending pathway in our pain circuit. The same man, when he goes into war, a bullet might pierce him from front to back, he might not know. The same man, when he comes to the home, a small thorn might give him shooting pain. What is the difference? The man is the same. What is the difference? The difference is state of mind. Okay? The state of mind can kill your pain. So, the first and foremost thing, you need to counsel the patient well, and you need to tell him, no, this is treatable, surgery is not required. Because lots of, mainly in eastern part of the world, people are scared of surgery. The moment you tell them surgery is not required, they are happy, half of their pain is gone. Strict postural care is the basic of pain management, and this is the new concept I am developing, I am working on. In pain management, postural care pain management, because in certain position you can see some people have sciatic pain while standing, some people have sciatic pain while sitting, some people have sciatic pain, some people sciatic pain relieves while doing kurmasana or flexion position, and some people sciatic pain gets aggravated by doing bhujangasana. So we need to find something that relieves his pain and start your treatment right from there. And yoga and exercises, I'll come to that again. Electrotherapy, massage, manual therapy, electric muscle stimulation, acupuncture, lifestyle modification. Calcium and vitamin D was given by previous doctors, and I supplemented him with vitamin B12, which is very essential for nerve regeneration. So in electrotherapy, we provided TENS, IFT, ultrasound phonophoresis, and heating modalities. That's just for pain management for few weeks only. And in electric muscle stimulation, we use galvanic current. There was muscle stimulation pad to dorsiflexus, and pain was given to EHL muscle. Yoga and exercise was used twice a day. I used Pavanamuktasana, Uttan Padasana, half crunches, ab set. This was done 10 to 15 repetitions twice a day. And in exercises, we prescribe ankle pumps, heel walking, toe walking, 20 to 100 reps. Okay? So basically, I treated the patient, no. The body heals itself. That's naturopathy. Okay? Till he heals, I just do what I do. I do pain management and I entertain him. And this is what we studied in naturopathy, right? These are the underlying mechanisms. All the underlying mechanisms are not very clear, but there are hundreds of mechanisms. If you Google, you'll come to this. Okay? I'm not going in depth on this. There are hundreds of mechanisms postulated. So these are the references. Any questions on this? And next time onwards, if someone tells you for sciatica or herniated disc, if someone tells you surgery is required, tell them flatly, it's not at all required. There might be 1 or 2% of the patients where surgery is required.
Thank you, Dr. Sunil. Our next speaker is Dr. Pradeep M. K. Nair.
और ज़्यादा ही पेन मैनेजमेंट करना हो अभी हम ऊपर आ जाते हैं, कुछ लोगों को सम्मानित करना है थोड़ा।